Most people are told that lymphedema is simply fluid building up in a leg, an arm, or another part of the body. Put on compression, elevate the limb, move more, try to keep the swelling down. And while those things can certainly be part of managing the condition, there is a deeper problem that often gets overlooked. Lymphedema is not simply a case of having too much water in your tissues. Another substance is involved, and that changes the entire story. Every day, fluid naturally leaves your blood vessels and enters the spaces surrounding your cells. That process is normal. Your body is constantly moving fluid in and out of tissues. The lymphatic system is supposed to collect what remains and return it to circulation. But when that drainage system cannot do its job properly, something more complicated begins to happen. Protein can remain trapped in the tissues along with the fluid. Over time, that protein can contribute to inflammation, changes in the tissue, and eventually a much harder, more resistant form of swelling. That is why understanding lymphedema requires looking beyond the water you can see and toward the system responsible for moving everything that should not remain there. Think about the lymphatic system as a vast drainage network running throughout the body. It is not simply a collection of tubes designed to carry water away. It also plays an important role in immune function and in transporting substances that need to leave the spaces between cells. Your blood circulation delivers oxygen and nutrients to tissues, but some of the fluid associated with that process naturally moves outside the blood vessels. Your lymphatic system has the responsibility of collecting that excess material and eventually returning it to the bloodstream. Under normal circumstances, this happens continuously, mostly without you ever noticing it. You do not feel your lymphatic system working. You do not wake up thinking about lymph flow. Yet every day, it quietly performs an enormous amount of work. When that system is damaged, obstructed, or unable to transport lymph effectively, the consequences can gradually become visible. This is where lymphedema becomes fundamentally different from ordinary swelling. With many forms of edema, fluid accumulates in the spaces between cells. But lymphedema involves impaired lymphatic transport, which means the tissues can retain both fluid and protein. That distinction matters because protein is not something the body can simply make disappear by removing water. If lymphatic drainage is impaired, protein can remain in the tissue. As time passes, persistent protein accumulation can contribute to inflammatory changes and tissue remodeling. The soft swelling that may appear at the beginning can therefore evolve into something much firmer. The tissue may become thickened, hardened, and increasingly difficult to manage. In other words, the condition can change over time. What begins as a drainage problem can eventually become a structural problem inside the tissue itself. That progression explains why early attention matters. When swelling is new, the affected area may feel soft and relatively easy to compress. But persistent lymphatic dysfunction can create an environment where inflammation and tissue changes reinforce one another. The more the tissue changes, the harder it may become for the lymphatic system to restore normal drainage. This creates a frustrating cycle. Poor drainage leaves material behind. That material contributes to tissue stress. The tissue changes, and the drainage problem can become even more difficult. By the time the swelling has been present for a long period, simply trying to remove visible water may not address everything happening underneath the skin. There is also a common misunderstanding about how lymph actually moves through the body. You may have heard that the lymphatic system has no pump and therefore depends entirely on your muscles to push fluid forward. Movement certainly matters. Walking, exercising, and contracting your muscles can assist lymph movement. But the physiology is more interesting than the simple idea that the lymphatic system is just a passive drainage pipe. Larger lymphatic vessels contain smooth muscle that can contract on their own. Research into lymph transport has shown that these contractions contribute substantially to the movement of lymph, including when a person is standing. So physical activity should not be dismissed, but neither should the lymphatic system be imagined as a completely passive system waiting for your muscles to push every drop of fluid forward. That leads to a much more important question. If lymphatic vessels have their own ability to contract, what can interfere with that process? One factor is inflammation. The inner lining of lymphatic vessels contains specialized cells, and those cells respond to the environment around them. Signaling molecules, including nitric oxide, are involved in regulating vascular and lymphatic function. When the surrounding tissue becomes chronically inflamed, normal signaling can become disrupted. A system designed to contract and transport fluid efficiently may no longer function in the same way. This is one reason chronic inflammation deserves attention when discussing lymphatic health. The issue is not simply whether there is inflammation somewhere in the body. The larger question is what persistent inflammation may be doing to the systems responsible for maintaining normal tissue balance. Another major issue is infection, particularly infection involving the skin. The lymphatic system and immune system are closely connected. Lymph nodes can enlarge when the body is responding to an infection because lymphatic tissues are actively involved in immune surveillance. This is why swollen lymph nodes can appear in the neck, armpits, or other areas when someone becomes sick. But the relationship works in both directions. The lymphatic system participates in the body's response to infection, and damage associated with infection can potentially affect lymphatic function. Experimental research has shown that certain skin infections can produce long-lasting changes in lymphatic function in animal models, with abnormalities persisting for many months after the infection itself has resolved. That does not mean every skin infection permanently damages the human lymphatic system, but it does highlight something important. Protecting the skin is not merely a cosmetic concern when someone has lymphatic problems. For a person already dealing with lymphedema, skincare becomes especially important. The skin forms a barrier between the outside world and the tissues beneath it. Cracks, wounds, irritation, and infections can create additional problems in an area that is already struggling with fluid drainage. That is why preventing injuries and responding promptly to signs of infection can be an important part of lymphedema management. If the skin becomes red, unusually warm, painful, or rapidly more swollen, medical evaluation may be necessary because infections can require treatment. Managing the condition is not just about reducing the size of a limb. It is also about protecting the tissue and preventing complications. There is another reason lymphedema often appears more prominently on one side of the body. The lymphatic system is organized into drainage territories. Each region of the body has pathways responsible for carrying lymph toward particular lymph nodes and larger lymphatic vessels. If part of that network is removed or damaged, the consequences can be concentrated in the area it was responsible for draining. Consider someone who undergoes surgery in which lymph nodes are removed from one side of the body. If the lymphatic drainage pathway serving that region has been disrupted, swelling may develop on that same side, while the opposite side remains relatively unaffected. This is one reason unilateral swelling can be an important clue that the lymphatic system itself has been compromised. Surgery is one recognized cause of lymphedema, particularly when lymph nodes or lymphatic vessels are removed or damaged. Cancer treatment can therefore create a situation in which a person develops swelling months or even years after the original treatment. Radiation, surgical disruption, tumor-related obstruction, and other forms of lymphatic injury can all affect drainage. But there is a fascinating part of the story that goes beyond the physical damage itself. Why do some people develop more severe lymphedema than others after apparently similar procedures? The answer may involve more than the number of lymph nodes removed. The overall metabolic environment of the body may also influence how the lymphatic system responds to injury. Research involving people treated for breast cancer has examined associations between metabolic conditions and the development of lymphedema. The reference material points to a long-term study involving thousands of breast cancer patients and reports a higher likelihood of lymphedema among patients who also had diabetes. The important idea is not that diabetes automatically causes lymphedema. It does not. Nor does having a metabolic condition mean someone who has undergone lymph node surgery will definitely develop swelling. Rather, the findings suggest that the body's metabolic state may influence the lymphatic system's vulnerability and its ability to cope with an existing injury.
That connection makes biological sense because metabolic dysfunction can affect many tissues at once. Persistently elevated blood glucose can contribute to inflammatory and vascular changes. The lining of blood vessels is sensitive to the metabolic environment, and lymphatic vessels also have specialized endothelial cells. If those cells are repeatedly exposed to conditions associated with chronic metabolic stress, normal lymphatic function may be affected. The smooth muscle surrounding larger lymphatic vessels also matters because those contractions help move lymph. If the signaling mechanisms controlling lymphatic contraction become impaired, the system may lose some of its efficiency. This does not mean that diet alone can cure lymphedema. That distinction is extremely important. Lymphedema can have many causes, and some involve permanent anatomical damage. If lymph nodes have been removed during cancer treatment, for example, changing your diet cannot simply recreate those missing structures. Likewise, no food can magically reopen a lymphatic vessel that has been surgically removed or physically obstructed. But the metabolic environment in which the remaining lymphatic system operates may still matter. Supporting overall metabolic health can be one component of a broader strategy alongside appropriate medical care, compression when recommended, movement, skin protection, and professional lymphedema management. This is also where the subject of water pills becomes complicated. Diuretics are medications that increase the amount of water and sodium excreted through the kidneys. They can be extremely useful for certain medical conditions involving fluid retention, and many people take them for legitimate reasons under medical supervision. But lymphedema is not simply a problem of excess water. The lymphatic system is responsible for clearing protein and other material from tissues. A medication that reduces circulating or extracellular water does not repair damaged lymphatic drainage. In some circumstances, reducing the water component while leaving the underlying protein-rich tissue environment unresolved may not address the actual mechanism of lymphedema. That is why someone should never stop a prescribed diuretic on their own simply because they have heard that it is not useful for lymphedema. The correct approach is to ask why the medication was prescribed in the first place. A person may have heart failure, kidney disease, liver disease, high blood pressure, or another condition for which a diuretic is medically important. The question is not whether the medication should automatically be removed. The question is whether it is being used to treat a condition that is different from the lymphatic swelling. That conversation belongs with the treating physician. Now consider what happens when the tissue remains chronically swollen. Persistent swelling is not just a number on a measuring tape. It changes the environment in which cells live. The skin can become stretched. The tissue can become less flexible. Inflammation can persist. Protein can accumulate. Fibrotic changes can develop. And as the tissue becomes more structurally altered, it can become increasingly difficult to reverse the process. This is why managing lymphedema early and consistently can be so important. The goal is not simply to make the limb look smaller for a few hours. The goal is to support long-term tissue health and lymphatic function. Movement remains an important part of that picture. Muscles surrounding lymphatic vessels can assist the movement of fluid, and regular physical activity has benefits that extend far beyond the lymphatic system. Exercise can improve circulation, support muscle strength, and contribute to better metabolic health. But people with lymphedema should not assume that more exercise is always better. The appropriate type and intensity can depend on the individual, the cause of the lymphedema, previous surgery, current symptoms, and other medical conditions. A properly designed exercise program can be valuable, particularly when developed with a clinician or a physical therapist familiar with lymphedema. Among different forms of exercise, resistance or strength training deserves particular attention. Building and maintaining muscle changes the way the body handles glucose and can improve insulin sensitivity. Muscle is one of the body's major sites for glucose disposal. So stronger and more active muscles
can contribute to better metabolic regulation. Strength training can also reduce the consequences of a sedentary lifestyle and support physical independence, particularly as people get older. For someone with lymphedema, the potential benefit is therefore not limited to lymph movement. Exercise can simultaneously address several factors that may influence overall health.
But there is a mistake people often make when they hear the words strength training. They imagine heavy barbells, intense gym sessions, or workouts designed for athletes. That is not what everyone needs. Strength training can begin with appropriately selected movements using body weight, resistance bands, machines, or light weights. The right starting point depends on the person. Someone recovering from cancer surgery may need a gradual progression. Someone with significant swelling may need specialized guidance. Someone who has been inactive for years may need to begin with very basic movements. The objective is not to prove how much weight you can lift. It is to give the body an appropriate stimulus while respecting its current limitations. There is another major lifestyle factor that deserves attention: metabolic health. When insulin resistance, elevated blood glucose, excess body fat, poor sleep, inactivity, and chronic inflammation occur together, the body operates under a very different physiological environment than it does when metabolic health is strong. Improving these factors can have widespread benefits. However, it is important to avoid the trap of claiming that one specific diet will cure lymphedema. The evidence does not justify such a promise. Nutrition should be viewed as part of the larger picture rather than a replacement for medical treatment. Low carbohydrate diets and intermittent fasting are often discussed in relation to metabolic health because they can help some people reduce calorie intake, improve glucose control, and change the body's fuel utilization. During carbohydrate restriction, the liver produces ketones, which can be used as an energy source by many tissues. The reference material emphasizes the ability of lymphatic cells to utilize ketones and presents low carbohydrate eating as a potentially useful strategy. But individual responses vary, and these dietary approaches are not appropriate for everyone. People taking glucose-lowering medication, pregnant individuals, people with certain medical conditions, or those with a history of disordered eating may require specific medical guidance before making major dietary changes. The bigger nutritional lesson is simpler. Instead of thinking only about what food might directly drain lymph, think about what your diet is doing to the metabolic environment of your body. Are you consistently consuming more energy than you need? Is your blood glucose frequently elevated? Are you getting enough protein and nutrient-dense foods? Are you eating enough fiber? Are most of your meals built around highly processed foods or around whole foods that provide vitamins, minerals, and other useful nutrients? These questions may not provide a magical answer to lymphedema, but they are much more meaningful than searching for a single lymph-cleansing food. The same principle applies to skin health. Your skin is not separate from the rest of your physiology. Nutrition, hydration, blood flow, immune function, and metabolic health all influence how tissues repair and respond to injury. But taking care of the skin from the inside does not eliminate the need for external protection. Moisturizing appropriately, preventing cracks, treating small wounds carefully, protecting the affected area from injury, and paying attention to changes can all be important. A person with lymphedema should not ignore repeated skin infections simply because an infection seems minor. In a vulnerable lymphatic system, prevention can be far more valuable than repeatedly dealing with complications after they occur. One of the most frustrating things about lymphedema is that it can feel as though the body is working against you. You may wake up and notice less swelling, only to see it increase later in the day. Your clothes may fit differently. A ring may feel tighter. A shoe may become uncomfortable. You may feel heaviness or tightness in the affected limb. And because the condition is often visible, it can affect confidence as well as physical comfort. Those experiences are real. Lymphedema is not simply an aesthetic inconvenience. It can interfere with mobility, daily activities, and quality of life.
The answer, however, is not to chase every supplement, detox product, or miracle treatment advertised online. The lymphatic system is complex, and the internet is full of products claiming to flush toxins, drain lymph, or eliminate swelling overnight. Be cautious. A supplement cannot replace a functioning lymphatic pathway. If there is a structural obstruction, taking a pill does not automatically remove it. If there is an infection, a supplement is not a substitute for appropriate medical treatment. And if swelling has suddenly appeared, especially on one side, it deserves proper evaluation rather than an assumption that it is harmless lymphedema. That last point is particularly important. Not every swollen leg is lymphedema. Swelling can have many causes, including problems involving the veins, heart, kidneys, liver, medications, inflammation, injury, infection, and blood clots. Sudden swelling, significant pain, redness, warmth, shortness of breath, chest pain, or other concerning symptoms require medical attention. The goal of understanding lymphedema is not to encourage self-diagnosis. It is to help people understand why the condition is more complicated than simply having too much water in a limb. And perhaps the most useful way to think about the entire subject is to stop viewing the lymphatic system as an isolated drainage pipe. It is part of a larger biological network. It interacts with the immune system. It interacts with the tissues. It responds to movement. It is influenced by inflammation. Its vessels have their own contractile mechanisms, and the condition of the surrounding tissue can influence how effectively it performs its job. That is why a comprehensive approach makes more sense than searching for one isolated solution. For someone already diagnosed with lymphedema, that comprehensive approach might include professional assessment, compression therapy when appropriate, movement and exercise, careful skin protection, weight and metabolic management when relevant, and monitoring for infections or changes in swelling. Some people may benefit from specialized lymphatic physical therapy and techniques such as manual lymphatic drainage, depending on their situation. The treatment plan should be individualized because the cause and severity of lymphedema can vary dramatically from one person to another. The metabolic connection is still an area where research continues to develop. Associations between diabetes, obesity, inflammation, and lymphedema are biologically plausible and supported by research. But that does not mean every case can be reduced to bad metabolism. A person can develop lymphedema after surgery despite having excellent metabolic health. Another person can have diabetes for decades without developing lymphedema. Biology rarely follows a single variable explanation. Genetics, anatomy, cancer treatment, surgery, infection, radiation, obesity, inflammation, activity, and many other factors can overlap. That is why the most responsible message is not that diet is the secret cure doctors have hidden from you. The more accurate message is that nutrition and metabolic health may be important pieces of a much larger puzzle. If someone tells you that one diet, one supplement, or one exercise will completely reverse lymphedema, be skeptical. If someone tells you that nothing except compression matters, that deserves skepticism too. The lymphatic system is too complex for either extreme. What you can do is focus on the fundamentals that support the body while working with qualified medical professionals. Stay physically active within your abilities. Maintain muscle. Protect the skin. Take infections seriously. Pay attention to blood glucose and other metabolic markers if they are relevant to you. Follow the treatment plan provided by your healthcare team. If you take medications such as diuretics, do not change them without discussing the reason they were prescribed. And if your swelling is changing, becoming harder, more painful, or suddenly appearing where it was not present before, get it evaluated rather than assuming you already know the cause. The deeper lesson is that visible swelling is only the part of the problem you can see. Underneath that swelling is a living tissue environment involving fluid, proteins, immune activity, inflammation, connective tissue, blood vessels, lymphatic vessels, and muscle. When the lymphatic system is functioning normally, all of these processes remain largely invisible. When drainage fails, the imbalance becomes obvious, and the longer the imbalance continues, the more the tissue itself can change. So if you have been thinking of lymphedema as nothing more than water trapped under the skin, it may be time to change that picture. Water is part of the story, but it is not the whole story. Protein matters. Lymphatic transport matters. The condition of the lymphatic vessels matters. Infection matters. Inflammation matters. Movement matters. Metabolic health may matter. And the health of the skin matters more than many people realize. There is no single switch that turns lymphedema off, but understanding what is actually happening gives you something far more valuable than a quick promise. It gives you a framework. Instead of only asking, how do I get this water out, you can begin asking better questions. Why is the lymphatic system struggling? Has it been damaged by surgery or radiation? Could infection be contributing to the problem? What is happening to the tissue over time? Are there metabolic factors that should be addressed? Am I protecting the skin? Am I moving safely and consistently? Am I following the treatment that is appropriate for my specific condition? Those questions can lead to better decisions than chasing temporary fixes. Because the goal is not simply to make swelling disappear for a few hours. The goal is to protect the tissue, support the drainage system that remains, reduce preventable complications, and improve your overall health at the same time. Lymphedema may begin with something that looks simple. A little swelling in a leg, an arm, or another part of the body. But behind that visible change is an entire biological system trying to maintain balance. When that system becomes impaired, the consequences can extend far beyond excess fluid. And once you understand that, the conversation about lymphedema changes completely. It becomes less about fighting water and more about supporting the body's systems responsible for keeping fluid, protein, inflammation, and the tissue environment under control. That is the perspective worth taking with you. Because when you understand what is happening beneath the surface, you can make much more informed choices about what comes next.